for inviting me to comment on Dr. Edmunds' presentation. I'd like to thank Dr. Edmunds for her interesting and thought-provoking talk. I feel like she covered a lot of the current issues and challenges and opportunities in our healthcare system. And I appreciated her comments on her connection with physical therapists. This kind of summarizes some of the things that resonated with me listening to her talk. Obviously, there's not enough time to talk about all this, so what I chose to do was focus on two areas. One, patient and family engagement, and two, social determinants of health, specifically in the context of learning health systems. And I mean, I think some of the chat that went on is, it is covered in what I'm going to be talking about. I believe both of these concepts are at the core of learning health systems, but can be challenging to operationalize and implement. Just a reminder of some of the key attributes of a learning health system. Patient engagement is one of the key components. And then also patient-centered care, which I would argue to really deliver patient-centered care, you need to understand about the social determinants of health. So thinking about the learning health system cycle, I'm assuming most folks on this call have some knowledge of this, how we use data to knowledge, and then knowledge to practice, and practice to data to kind of start the cycle again. So basically using the data, trying to apply it, and then making changes. So where does consumer or patient engagement fit in this cycle? I think Dr. Edmunds hit upon some of this. I kind of think of three areas in the context of learning health systems. One is the patient engagement during the clinical encounter. The lived experiences that providers have with their patients certainly gives them internal data and data that they can use to inform, the learning health system cycle. I also think about patient engagement in regard to informing learning health systems activities, whether it be QI or research. And this would be the situation where the patient is part of the learning collaborative and actually can participate in the entire cycle, very much like when Dr. Edmunds talked about how stakeholders can be involved in the entire research process. And then the other area I think is how we can gather data on care experiences. And the most obvious example of that is, to me at least, is satisfaction surveys. I'm sure most of you have completed those for, following visits to care providers. I'm not aware as much about what's going on in the rehabilitation field in that regard. At UPMC, I don't think that they really have rehabilitation focused satisfaction surveys, but I think that's something for us to kind of think about or consider. So how can we engage patients more effectively? I think there are challenges in patient engagement, particularly in the context of learning health systems. And again, I think some of this was hit upon during the discussion. I think over the past 5 to 10 years, the research community has recognized the value of patient engagement, but it's been hard to quantify that value scientifically. And there's also been not a lot of scientific information on what approaches are most effective and when perhaps in the cycle it's most important to have patient engagement. I think another challenge with rehabilitation is that rehabilitation care is very broad. We treat a lot of diagnoses. We treat patients across the lifespan. We deliver care in various settings. Even the type of care we deliver can be rehabilitative or preventive. And I think if stakeholder engagement or patient engagement is going to be most effective, we really need to be engaging the patients that are living the experiences or the problem that we're trying to address. So it's it's a little bit overwhelming thinking that, like, you have to kind of have all these different types of patient stakeholders versus kind of finding one that would represent all the problems, but I don't think that that's really useful. And then finally, just figuring out how to support the engagement of patients, I think is challenging, especially in the context of learning health systems. I think we need to support patients' engagement financially. And so that can be difficult if there's not research funding or funding that's been allotted to do this. We also need to support patients in other ways by having clearly defined roles and trying to promote equitable participation. So I think that, again, in learning health systems, this can be a challenge. And one of the primary things I think that has to happen is that there has to be health system buy-in to recognize the importance of this. And I think to go beyond kind of these advisory boards where patients participate and really getting more into offering input to try to solve a specific problem. So the next area I just wanted to hit upon is learning health systems and social determinants of health. I would argue that if the ultimate goal of learning health systems is to improve health, that we need to consider social determinants of health. And if we don't integrate those data into the learning health system cycle, where the learning health system isn't going to really reach its full potential. I think we're all probably very familiar with social determinants of health. This is just the Healthy People 2030, conceptualization of social determinants. There's some different frameworks out there. I think what's more compelling is just how much social determinants contribute to health relative to healthcare. And again, I think there's different infographics out there. This one is showing how socioeconomic factors and the physical environment, which really would be social determinants of health, impact the health of individuals relative to healthcare. So it really shows you how we really can't ignore these things that have such a big impact on health. So how should learning health systems incorporate social determinants of health? I think this is this is an area where there's a lot of room for growth. Currently, I don't think that, at least the EHRs that I've been involved with, currently we don't collect a lot of information on social determinants of health. And so the questions are, what data should we be collecting? Are there certain measures that are more important than others, especially in the context of rehabilitation care? How can we standardize those measures? And so I think some of that was brought up in the chat. And I think collecting data is just the start. Then we need to, use the data and learn, in the spirit of learning health systems. And I think the only way that that's really going to happen is if health systems prioritize health equity. And then we also need to consider how to engage the community, particularly the disadvantaged and vulnerable populations that are impacted by these various social determinants. So I guess I don't have the answers here. I was just trying to kind of present some ideas and issues that we might think about as we move forward and try to learn and become better learning health systems researchers. So I thank you for your time. The daffodils are out here in Pittsburgh, but it's supposed to be 20 degrees tomorrow, so we're not quite there yet. So thanks for your time.